Good evening, everyone. Aloha and welcome to the community reporting meeting on pesticides and public health. My name is Annie Frederick. I'm the executive director of the Hawaii Alliance for Progressive Action. Thank you so much to everybody who is in attendance tonight. HAPA's mission is to catalyze community empowerment and systemic change towards valuing people in Aina ahead of corporate profits. And before we jump into our main speakers tonight, I wanted to just provide a little bit of information about our organization, how we came to this work, and a little context for our conversation this evening. We'll have some wonderful speakers who will be sharing their research into restricted use pesticide usage, both Hawaii-wide and with a special focus on the hotspots in central Oʻahu. And in particular, the heavy usage of fumigants and the potential health risks associated. But before we get started, I'll just share that HAPA was really founded out of the movement to enact greater transparency and public health protections from the agrochemical industry and its pesticide usage in Hawaii. Beginning in around 2006 through 2008, students and teachers at Waimea Canyon School in West Kauai became ill during times that Syngenta was spraying directly adjacent to the school. There are incidents that happened like that around Hawaii where communities living specifically adjacent to agrochemical fields began to experience health impacts and just ask really basic questions about what they were exposed to, and to ask for public health protections. Starting in around 2012 to 14, some of that community engagement and activism began to ramp up. It was really not until 2018, after years of community advocacy, that the state took action and passed Act 45, which for the first time required users of restricted use pesticides to report on their usage. And however, as you'll hear from some of our speakers, there's been a long journey to actually make that data really truly accessible to the public. And so you'll hear a little bit more about some of the challenges that we faced in making that data accessible and legible. However, when they passed Act 45, probably the most meaningful part of that measure was the ban on chlorpyrifos, which was the first in the nation, and then many other states followed suit afterwards. And then another piece that communities had been advocating for was enactment of greater buffer zones around schools and other sensitive areas. And at the time when Act 45 was passed in 2018, it was 100 feet, which is really just not supported by the science on pesticide drift and the health risks associated, specifically to children who are the most vulnerable. But along the way, as we were researching some of the studies around pesticide impacts, we came across time and time again the Chamacos studies that came out of UC Berkeley's Center for Environmental Research and Community Health. And so eventually we reached out to the researchers at Search, and they put us in touch with one of their former colleagues who had worked on those studies and then more recently had taken a position at the University of Hawaii in the School of Public Health. And so that's how we were initially connected with Dr. Rosanna Weldon, who goes by Sani. She is an environmental health scientist and associate specialist faculty member in the Department of Public Health Sciences at the University of Hawaii at Manoa. She is also the director of the Red Hill Registry within the Office of Strategic Health Initiatives at the University of Hawaii System. Her research interests and expertise are in exposure assessment and environmental epidemiology, with a particular focus on children and reproduction. During her career in public health, she has worked on various large-scale, federally funded studies to assess associations between chemical exposures, including pesticides, benzene, PFAS, persistent organic pollutants, phthalates, you can correct me on the pronunciation, and health outcomes. And so we're so grateful that we were able to develop this collaboration with the University of Hawaii and with Sani in particular to begin to try to make sense of this data, which, as you'll hear, there's still a lot of work to be done, and there's a really pretty big lift around just getting that data into a format to make it understandable. But With that, I'll hand it over to Dr. Weldon. Thank you so much for your work.
Thank you, Annie, for the lovely introduction. I'm going to share my screen. Make sure I'm in the right place here. Okay. Well, as you heard, my name is Rosanna Weldon, but most people call me Sonny. I am really excited and proud to be here with HAPA today and to present some of our work on restricted use pesticides in Hawaii, including our community concerns and possible links with health. So many of you have attended HAPA's first meeting. I'm not sure when that was held. It was just a few years ago in Central Oahu. And that meeting was held after understanding that the intense use of pesticides in around your community from the 2019 RUP data. Now, you can see pretty starkly that these areas with high pesticide use are also very, very close to communities where a lot of people live. And so with the intensity to over 200,000 pounds of pesticide use and the proximity to the neighborhoods, we were concerned about the pesticide exposures in that area. So there were two major pesticides used in Central Oahu that really grabbed our attention. These are fumigants, and one of them is 1,3-dichloropropene, and the other is sodium methyl dithiocarbamate. Now we call them 1,3-D and metam sodium. So due to environmental and health concerns, these fumigants have been banned in some countries. They're really not so good for your health. And in 2019, over 200,000 pounds of 1,3-D alone were used, and just about 100,000 pounds of metam sodium were used, not just in Central Oahu, but throughout the state. These fumigants, they're invisible, they evaporate easily, and they're prone to drift. If it escapes from the ground, it can linger near houses, schools, and businesses where people can inhale it. And in the environment, it can lead to groundwater contamination. These chemicals are toxic if inhaled, and exposure can lead to symptoms like headaches or dizziness, nausea, and vomiting. And there are long-term health impacts, including cancer and respiratory, reproductive, and endocrine impacts. So as Annie mentioned, a few years ago, a colleague of mine from California connected me with Annie and Fern to see if there were ways that we could collaborate. So shortly after I joined the faculty at UH Manoa, I became aware of a funding opportunity for a pilot project through the Ola Hawaii program. Now, Ola means health in the Hawaiian language, and in this case, Hawaii is an acronym for health and wellness achieved by impacting inequalities. In particular, health disparities have been identified for racial and ethnic groups such as Native Hawaiians and other Pacific Islanders and Filipinos. So the Ola Hawaii program is a 5-year grant supported by the National Institute on Minority Health and Health Disparities through the research centers in minority institutions. And their goal is to improve minority health and reduce health and healthcare access disparities for communities in Hawaii that may be suffering disproportionately. So in 2023, we applied for funding and received a small amount of funding for this pilot project in 2024. Our pilot project included 3 specific aims. The first aim was to host focus groups with community members of Central Oahu to listen to their health and environmental concerns. We had some evidence, but we just didn't know if the community was concerned about some of these exposures. The second aim was to host focus groups with different kinds of growers in our state. And there it was a little bit of a different focus. We wanted to discuss farming practices in light of weather over the years, and to see whether, changing weather patterns may affect the way that they need to change their operations. And the third aim was to identify sources of health and ethnic data in Hawaii statewide that can be used with Geographic Information System or GIS maps of pesticide use for a secondary data analysis. We also wanted to create models of associations between these restricted use pesticides exposures throughout Hawaii and health issues such as asthma and cancer. So now I have the privilege and honor of sharing some of our results to date on the focus groups with the community members of Central Oahu. I've only selected a few questions to focus on because we have a lot to cover today. So far I've completed 3 focus groups with residents of Central Oahu, and the 4th and final focus group will be next Wednesday. So I'll have more information at the end of the presentation if you're interested in participating. Clearly, I have not completed the analysis, but I want to let you know that the community is saying in general, what they're saying in general. And when I ask almost at the beginning of our focus groups, what makes Central Oahu special? And the most frequent response was a connection to place and family roots. And that's demonstrated by the quote on the left: "I am part of Whitmore's heart and soul." Participants also mentioned its natural beauty, such as how it is cooler and green and connected to just about each moku. The historical and cultural significance was also discussed, as demonstrated by this quote: "To our people of Oahu, Kukaniloko is a sacred space, the piko, and it has important significance." Another question asked about participants' feelings about the distance between their home or school and agricultural operations. Many people talked about pesticide exposure and health concerns, with one participant mentioning the proximity of Leilehua High School to the agricultural fields. It's literally like in our kids' high school. It's right next to the football field, too, is what they said. Community and environmental awareness was also frequently mentioned. One participant was concerned about the transparency when saying, "How do you even find access to this kind of information? It's on purpose that they keep the community in the dark about these kinds of things." Other topics mentioned were education, corporate and industrial influence, proximity to agricultural land, and safety concerns, as well as a desire for more sustainable farming and local food production. When asked about how pesticides have impacted health, many people mentioned respiratory issues such as asthma, allergies, and eczema, especially in relation to the environment that they live in. There's also a recurring concern about the potential link between environmental toxins and health conditions, including cancer. One participant said, "I feel like the chemical exposures and pesticides are really everywhere, and it's hard to avoid it. And I do get concerned because my mom's health conditions are getting pretty bad." Symptoms like nosebleeds, skin irritation, headaches, and respiratory issues were commonly expressed. The use of pesticides, herbicides such as Roundup, and other chemicals like Agent Orange were also mentioned, with concerns about their long-term health impacts. Individuals reported noticing their own or their family's health deterioration in areas with frequent chemical exposure, such as near schools or agricultural sites where spraying is common. And participants also expressed uncertainty about whether their health problems are directly caused by the environment, but they feel there might be a connection, especially given, patterns within their families or their communities. There are lots of references to generational health issues such as diabetes, kidney problems, cancer, respiratory diseases that may be linked to exposure. And some participants mentioned that certain conditions seem to run through their families without clear explanations. There was a concept of generational poisoning mentioned, indicating long-term effects, and a strong focus on the health of children and future generations, especially with the fear of long-term health effects from living in these areas with the chemical exposure. At the end of each focus group, I asked participants about the most important issue that we discussed. So here's a list of the themes that emerged from what participants said. More than half of the participants commented on ways that they could take further action to protect their families from pesticide exposure, with one person saying, "Honestly, having a focus group like this where we can try and make a change, or at least give our little opinion, hoping it'll help somewhere in the near future." More than a quarter of the people talked about the importance of voting for politicians with particular appreciation for a specific politician. Awareness of pesticide was also frequently discussed. Nearly a quarter of participants talked about wanting to stay connected with me, as well as with the individuals in the focus groups, to continue discussions around pesticide exposure. And the same number discussed awareness of health implications of pesticides. One participant said, "Put me on a list and I'd love to stay in touch and do stuff." I also want to mention that the idea of consent, or rather the lack of consent, was discussed. One participant said, "They tell you, okay, we're going to spray around your house, and you can't really stop them." So for this particular presentation, I wanted to talk mostly about Central Oahu. So I'll only briefly mention the second specific aim, which was to host focus groups with growers to discuss farming practices and weather patterns over time. So for aim 2, I have completed 2 of the 3 planned focus groups with Native Hawaiian and regenerative growers. And I've met some challenges connecting with the large scale commercial growers. But the final focus group with smaller scale growers will occur next week as well. And there'll be information on that at the end. When I asked about the most important thing we discussed at the end of these focus groups, the themes that emerged included resilience and overcoming challenges, such as dealing with pests, environmental changes, and limited resources. One participant appreciated hearing about how you guys are all trying different methods and kind of have the same mindset of not going chemical to help with different pests and environmental changes. However, there's also a sense of hope, resilience, and a collective determination to continue pushing forward despite these challenges. A recurring theme is the desire to prioritize sustainability in farming practices. The concept of caring for the land, or aloha aina, love of the land, is central to the discussions. The need to look ahead and plan for future sustainability and growth is also a common theme. And this includes fostering stronger leadership, creating sustainable careers in farming, and organizing collective action to address larger systemic issues that affect farming communities. The value of networking and learning from each other's experiences, practices, and struggles is also a frequent point of discussion. There's a shared desire to exchange knowledge and ideas to improve practices and overcome shared challenges. Cultural connection, community collaboration, youth involvement, and policy and legislation were also discussed, with one participant saying, just having the opportunity to get together to talk stories. How do we engineer the spaces to come together? And then how do we malama people within that space to create action that we need? So with the community comments in mind, I'd like to turn to the third aim of the pilot study, which is to identify sources of health and ethnic data that can be used to map pesticide use across the state and determine associations between restricted use pesticide exposures, or RUPs. You'll see RUP a lot as I go on, and health issues, including asthma and cancer, which is much more involved. So I want to mention that this is a work in progress. As you know, Hawaii has a long agricultural history and in many ways is an ideal location for growing crops due to its long growing season. As you may have heard earlier, as Annie mentioned, in 2018, the Hawaii State Legislature passed Act 45, which required pesticide applicators to report the name, amount, and location of restricted use pesticides applied in the fields, among other things. So as I mentioned earlier, it was soon noticed that the two highly volatile fumigants, 1,3-D and metam-sodium, were highly used in the state, and particularly in central Oʻahu. So these fumigants, as I mentioned earlier, have been linked to cancer and asthma. And in addition, researchers have reported associations of 1,3-D use and asthma by race, particularly among non-Hispanic, Black, and Hispanic populations. But there's no information on relationships between RUPs and asthma or cancer among Filipinos or Native Hawaiians or other Pacific Islanders. And so this pilot study is the first to use Hawaii's RUP data in a public health context. So as part of our methods, a really critical step was that HAPA requested the RUP data for 2019, 2020, and 2021 from the state through the UIPA mechanism, which is Hawaii's public records law. Once the data were received, they required extensive cleaning, including converting from PDF format to spreadsheets, converting amounts of pesticide used to standardize the units to pounds of active ingredient, standardizing tax map keys to eliminate inconsistent numbers of digits, use of dashes or other text, and multiple TMKs per amount reported, and converting the area treated to standardize the units to acres. Once the data were cleaned, ArcGIS tools were used to map the relationships between pesticides and ethnicity. I want to give a shout out to Lisa Webster, who helped me with all of the GIS stuff. So this required joining several data sets, including the RUP data set containing the tax map key information with the Hawaii statewide GIS TMK parcel layer, and then joining them with the census block layers, and also with the ArcGIS Living Atlas American Community Survey conducted in 2018 to 2022 to access the ethnicity data. So the GIS table was then exported and available for, and as well as the health data that was obtained from the Hawaii Health Matters it's a publicly available website for state health information for asthma and cancer. So then that GIS data table was exported and available for statistical analysis, which we actually have not done extensively yet using Stata. I'd like to point out that this data table was a limited data set of the pesticides and ethnicity matched. So it contains information only for areas where 1,3-D or metam-sodium were used for some of these analyses. So before we get to the results of the analysis, I want to show some trends of 1,3-D and metam-sodium use. In Hawaii, 1,3-D use dipped a bit in 2020, but rose higher in 2021 compared to 2019. So it's not clear why that dip happened. Maybe it was COVID-19. There are plenty of other reasons. Could just be a reporting issue or just less use. But the intensity, or the pounds per acre, was very similar at about 320 for 2019 and 2021. So I also added California to this table to demonstrate a few points. First, as the largest agricultural producer in the United States, it's not surprising that their pesticide usage is much higher than in Hawaii, but their intensity of 1,3-D use is lower than Hawaii's. Metam-sodium use in Hawaii appears to be decreasing over time, but the intensity remains the same between 2019 and 2020. Metam-sodium use in 2021 was really driven by a single tax map key with 13 entries where the same amount of active ingredient was applied multiple times across the same 4,000 or so acres. So that data point is a little bit different. Metam-sodium use and intensity in California are also much higher than in Hawaii. So we get to some of our first maps, and this is pretty exciting because they're relatively new information for me. Here we see the total pounds of RUP use from 2019 to 2021, with red indicating 1,3-D and blue metam-sodium. The larger circles indicate more pounds of pesticide use, so that'll be recurring throughout the maps that you see. And you can clearly see that the highest usage is in central Oʻahu. So from the maps, from here forward, we're going to focus on the use in Oʻahu. Here we see a summary of the ethnicity data as percent of the population. And just for reference, about a quarter of Hawaii's population is Filipino and about 10% are Native Hawaiian or Pacific Islander. So we see that there are slightly more Filipinos living in areas with fumigant use, particularly in areas with metam-sodium use, whereas there are fewer Native Hawaiians and Pacific Islanders living in areas with fumigant use compared to the statewide population. This map shows the percent of population that identifies as Filipino per census tract and pesticide use by year at the parcel level. In general, it appears that there's a higher percentage of Filipinos residing in areas with metam-sodium use than 1,3-D use. But again, I have not done any detailed statistical analysis. So really, we just get to look at the pretty pictures and draw some conclusions from them at this point. And this is a map of the percent of population that is Native Hawaiian and other Pacific Islander per census tract and pesticide use by year at the parcel level. In this case, there doesn't seem to be a relationship between Native Hawaiian ethnicity and RUP use. So now I'd like to show you a map of average asthma rate per census tract and RUP use by year at the parcel level. Blue and green indicate metam-sodium, red, orange, and yellow indicate 1,3-D. And although we have not performed any statistical analysis, there appears to be a possible association between asthma and RUP use. However, there does not appear to be an association between average annual total cancer rates for 2019 to 2021. And this is at the school complex level because the data are not available for all areas at other levels, and pesticide use by year at the parcel level. I also wanted to show a map of percent of population that farms as an occupation per census tract and the pesticide use by year at the parcel level. And farmers themselves do tend to live in areas near where RUPs are used, which makes a lot of sense. And in this map of where farmers live, asthma rates per census tract, and pesticide use by year at the parcel level, there's a suggested association between areas with both high farming occupation and asthma, which are those dark purple areas, in relation to RUP use. So we're starting to wind this down a bit. When we started working with the RUP data, we were immediately met with some challenges. So we want to acknowledge that the state provides summaries which are helpful for determining which RUPs are used in Hawaii in terms of, the total aggregated amount, but they don't indicate any location data for mapping or joining with other public data sets. So that's why we had to do the UIPA request from the state. And the UIPA request is time consuming. In addition, the data cleaning is time consuming and requires assumptions that may introduce some error. In 2019 alone, there were over 8,000 entries of RUP use, and nearly every field required data cleaning, including calculating the pounds of pesticide used, as I mentioned earlier, standardizing all the units of everything, and even the spelling of some of the pesticide names. In addition, there's a huge range of acreage represented by a tax map key. So this identifier can signal a small parcel with only a family home on it or a ranch that is thousands of acres large. In comparison, California's pesticide use reporting location data is refined to 1 square mile. The lack of precise location data will introduce error in exposure estimates, and also for our mapping. And so there's clearly more work to be done, and we plan to draft a report of our findings as we, determine more associations and do more statistical analysis. 2 weeks ago, I participated in an info brief session with the state's legislators to discuss pesticide use in the state and buffer zones. In this session, I made several recommendations regarding the restricted use pesticide reporting system. Ideally, we would like Hawaii's RUP data to be easier to use for public health research. This would require location reporting that is more precise than the TMK, a standardized reporting mechanism to help standardize the data collection. And we are suggesting this could either be some sort of standardized form, or even better would be an electronic data collection method. And lastly, given that the state already provides a statewide summary of RUP use, we assume that somebody spent the time to clean all the data, and that data could already be available in some spreadsheet form. So we'd recommend that the state provide cleaned RUP data to those who request it. I would like to thank the many people who have provided assistance and support for this project, including all the wonderful people at HAPA and my students and collaborators and mentor at the University of Hawaii, as well as many investigators at the Ola Hawaii Corps who have helped. There is the award information, and I would like to invite those who are interested in participating. Our very last focus group with Central Oahu residents will be held on next Wednesday. And if you happen to be a grower, we are having our last focus group next Thursday. And you can email Isis Osborne at isis@hapahi.org for more information. That's all I have. Thank you.
Thank you so much, Sani. Really wonderful just to be able to begin to do the research after so many years of even just trying to access the data. So it feels like a really important milestone to be here, and we look forward to more collaborations with Dr. Weldon. I would like to introduce our next speaker, Fern Holland, who is the Pesticides and Public Health Campaign Director at HAPA. And I'll just say before her intro, really so much of the founding of HAPA and the work that we do grew out of a lot of Fern and many others' activism, and just trying to get some basic accountability and protections for community. Fern was born and raised on Kauai and received her Bachelor's of Science with triple majors in wildlife management, environmental science, and marine biology from Griffith University School of Environment on the Gold Coast of Australia. Since then, Fern has worked professionally and as an environmental scientist and consultant for ecological, contaminated land, and other environmental assessments, both in Hawaii and overseas. She has worked for nearly 18 years on environmental justice issues associated with industrialized agriculture and biotech, pesticide, and GE experimentation in Hawaii and globally. And Fern is the Pesticides and Public Health, as I mentioned, campaign director at HAPA. And she's also now one of our Kauai County Council members. So we're grateful to have her in both capacities. And she has been doing a deep dive into, as you heard from Sani, the data. It's taken a tremendous amount of work to just get it to a point where it's legible and intelligible for the public. So thank you, Fern, for all of that hard work. And with that, I will turn it over to you.
Thank you, Annie. Thank you all so much. So I'm going to be talking a little bit more and just expanding on what Sani just shared. It's been wonderful having her with her background on science and pesticide research on board with this, because that's a lot of what we've been missing in this conversation over the last 10 years, is connecting it with the research and the science. So I'm going to talk a little bit about what we found since we met. I think it was January 2023 when we all connected and had that first public meeting. And I just want to recap a few things today, just to be clear about the scope of what we are talking about and what we're not talking about. We're discussing the restricted use pesticides that are reported through the state reporting as per Act 45, as Annie brought up. But this does not include general use pesticides. And so everything purchased over the counter that doesn't require specific certifications and licenses to apply and purchase. These restricted use pesticides also vary from state to state, and so every state has a different list of those that are uh, registered as restricted use pesticides. And usually that's because there's significant either science or concern around the health of humans or the environment because of exposure to these particular pesticides. Over the last, yes, almost 18 years, this year, a lot of this conversation that has circled through communities is based around a failure to really protect the public interest and human health. And a lot of that has to do with the way things are structured in our government, the way that we see a lack of independent study and regulation. As most of the studies are conducted by the pesticide producers. It also includes huge industry lobbying, which is a really big aspect of what's left us in this situation, and also the lack of precautionary principle. These things collectively have resulted in us finding this cycle of pesticide treadmill. And as Annie was talking about a little bit of the history, for me, I was first involved in this direct request for disclosure during Bill 2491 on Kauai in 2013, so 12 years ago, where we collectively kind of got together multiple islands organized to try to get rights for either protections or disclosures. And then in 2016, all of those county measures were overturned. And it's only been very recently, historically, that any of this data is even available. And immediately when we got the first round of 2019 data, the central Oahu impacts were so significant and the area so large that was impacted that immediately our energies kind of started to look at, well, what is going on in this area? And we did a general calculation of all of the reporting of 2019 across all of Hawaii and realized that really only 10 users were accounting for approximately 99% of all the RUP usage being used in Hawaii. And of those, about 5 to 10 of them, you know, producing all of these 99% of the RUP use, but only 5 of them were really growing food, particularly for local consumption. And so we found that combined on Oahu in 2019, almost 300,000 pounds of RUPs were reported. And that was about 288,632 pounds collectively that we acquired. And then in 2020, about 201. So you see that dip that Sani was referring to in her data as well, where it kind of drops down to 201,845 pounds roughly. And then in 2021, you see that go back up. So you see that dip in 2020, but really after me spending like the last 3 days really trying to go through a lot of these numbers line by line, it's apparent that there may be complete sections that have not been reported on, either parcels and particular chemicals, which I'll talk a little bit about. So we found that, initially we were talking about 31 different active ingredients and 32 formulations in 2019. As we started to look at 2020 and 2021, that changes a little bit. We see a few less of the active ingredients, but actually more formulations of restricted use pesticides. So the active ingredient is the ingredient inside of a pesticide that works, and that's what we're counting with pounds. But there's actually restricted use pesticide is actually the formulation of that product, which has a name. Like, for example, Roundup is a general use pesticide formulation, but the active ingredient is glyphosate. So then you can see here on this map that a lot of the central Oahu area is really that concern, those lots. There's about 1.2 mile distance to Waialua and less than a mile to the Wahiwa areas, even closer when you start to look at those adjacent farms next to the Dole facility. And then also concerning are the areas around Waialua, particularly that parcel that's very close to the Ranch Camp School. This is what we flagged in 2019, a lot of these concerns and these maps. So these maps are from 2019. We're in the process of mapping 2020 and 2021 for that as well. And that's coming, but not really available to show yet, unfortunately. However, when we look at the changes between 2019, 2020, 2021, we see that the 1,3-D and the metamsodium by far being the pesticides that are the most heavily used, like Sani was talking about. And within that, I realized that these numbers are actually really different. for 2020, because, and this is what makes me think that the reporting is not accurate, because bromacil and diazinon drop off entirely, where there's actually no use reported of those two chemicals in 2020 at all. And then we have, these other chemicals that kind of pop up in different amounts that we hadn't seen in 2019. And so I'm starting to dive into that difference. Definitely continue to be really concerned about paraquat use, particularly. We see, about over 800 pounds of the active ingredient paraquat used in addition to these fumigants that are really dwarf the scale of the graphs and numbers because there's so much being applied. But we see, thousands of pounds of methamil, which is interesting. We didn't have anything close to that in 2019. And then we kind of just see a wider spread of different restricted use pesticides used, but definitely concerning that we're into the 3,000, 1,600 pounds of cyantraniliprole and chlorantraniliprole, which is both of those just exceed a really high level of what we would expect and didn't see anything close to that in 2019. Oxamil was one of the chemicals that came up in 2019, coming up again in 2020. Particularly some of these pesticides that we looked at in 2019, for example, paraquat, which is known as one of the most toxic pesticides globally. It's an herbicide. It's already banned in 58 different countries, and there's huge concern about the impact both to human health and the environment about that. And then you also see in 2021, 1,3-D used again, like Sani mentioned, higher again than 2020, but we don't see metam sodium used on Oʻahu. We do see it used elsewhere in the state, but not on Oʻahu. So that's a significant change from that. And that 1,3-D is banned in 34 different countries. So that's obviously very concerning. Then in 2021, we also see some real upticks in certain chemicals that also come back that we weren't expecting. So diazinon, right? So I mentioned that completely disappeared in 2020, but then here it comes up with over 11,000 pounds in 2021. So trying to figure out if there's just complete gaps in the reporting. It's really difficult. As Dr. Weldon talked about, the reporting is very difficult to analyze, but specifically, it's self-reported. There's no oversight really on if they're reporting correctly, accurately, even reporting at all what they're using. There's also a huge amount of questions, I'll say. We have a huge amount of questions about what is being exempted from reporting. And so it's hard to navigate if this is even the true extent of the use. But kind of concerning that in 2019, diazinon is a heavily used chemical on Oʻahu, then disappears in 2020, and then comes back in 2021 with this really high numbers. Abec, abamectin, I think it's called, is also really surprising. We've never seen in the previous 2 years anything similar to this use of over 6,000 pounds of active ingredient. Oxamil, again, with a big uptick, over 4,000 pounds, and methamil with over 4,000 pounds. And so these numbers were pretty surprising. Also, again, paraquat coming back with 2021 with a vengeance, with about 1,000 pounds more than what was used in 2020. And so really concerning about where those changes are, what's happening, why this huge uptick again in paraquat. Bromacil also very high. And there's quite a few others that were also reported in the hundreds. But I just kind of pulled out some of the things that were the most heavily used, because it's hard for us to figure out exactly, given the changes in reporting. It's hard to compare exactly what I compared before. And once we have the mapping information and I can kind of look at TMKs as per mapped, I can do a better job of summarizing specific applications surrounding specific communities. But right now, the data is just a huge list of all of these different applications over time, and trying to compare them is difficult by location without the mapping, but is also difficult because you sometimes, like now in the 2021 data, they've kept out a lot of the applicant who the person is applying it. So that also becomes difficult. So this data has been really hard to navigate, and I've done my best to just kind of summarize some of the other chemicals that are being used, that are very concerning outside of the fumigants. The fumigants are particularly concerning. As Dr. Weldon mentioned, they have prone to drift behavior. So they're able to move very, very far, which is what that means. And they're able to settle around homes and communities, because of the weight, the molecular weight of the formulation. They're applied as a gas. So obviously they move in air quite easily. And so you see that high risk of drift and contamination, which is very concerning. And a lot of these other pesticides, each one of them has a range of impacts, and threats associated with them. And we know that particularly paraquat has been recently connected with a ample amount of science to Parkinson's disease. And there's also a wide range of human impact to exposure, including reproductive cancers, physical immediate effects like headaches, nausea, vomiting. We see long-term respiratory impact as well, and even organ failure, and Parkinson's and organ failure directly related to paraquat quite clearly in the data. Um, there's also obviously environmental impact, and this is only a snippet of what we're being exposed to. So there's all of these restricted use pesticides being used, and we also have general use pesticides and a wide swath of other chemicals that are moving through the system. One of the things that is really important to talk about with all of this is that there's never really been independent studies of any kind that look at the impacts of combining these pesticides. So we don't know what even one of these RUPs mixed with another one of these RUPs could potentially have as an impact to human health or environment, one less a multitude of them. So when we have, you know, 20 or so restricted use pesticides being used in a relatively small area. Most of this use on Oahu almost entirely is central Oahu, and the bulk of that is north central Oahu. And so when you have such a mixture of pesticides, there becomes risk of association with these chemicals mixing, that could make them more toxic, could change the way that they interact with people's health, and your body, or the environment. And that can also change where they end up in the environment, because they could end up in soil, water, groundwater, run off into the ocean, or drift through the air like the fumigants are known to do. So that's some of the questions that we have. And unfortunately, with this data, the more that we dive into it, the more questions we have, which is why we've been fighting for better reporting over these years, better accountability on use, and obviously better protections for communities as well. It's frustrating for me, all these years after our community stood up, marched, organized, passed county measures, we still don't have significant buffer zones, even around schools, one less homes and communities, which also deserve to be protected and buffered. And navigating that is difficult when you have this kind of data and science, and you're like, but look, this is all the things that are being used, and you really struggle to get action. So it's been frustrating, and probably a lot more questions than we have answers around this use. But I think that's my last slide. Yep, that's what I'm here to share today, and I hope that's helpful. And anybody can always reach out, of course, through our HAPA website with my contacts if there's any questions, or if I can expand on any of that in any way.
Thank you so much, Fern. I swear, Fern has been working on this for so long, and she's we just keep plugging away. I think one of the things we feel really accountable for as an organization is that, this was one of the struggles that we were founded out of, and now that we've, finally supposedly won the data, that there's just responsibility to try and make it as publicly accessible as we can, despite all the challenges. So just want to thank Fern for her tireless work to do that. And with that, I'm going to invite in our next speaker, Representative Amy Peruso, who is the State House Rep for District 46. Representative Peruso is a veteran DOE social studies teacher, was the first woman elected to represent District 46 in 2018. Her district includes Kunia, parts of Mililani, Wahiawa, Whitmore Village, and further north, there's several neighborhoods that are included in her district. And as you've heard, some of the heaviest RUP uses, unfortunately, in her district, but we're just really grateful to have been able to work so closely with her over the years to try to just find ways to enact some common sense protections to increase better transparency around the information that's available. So I just wanted to invite her in to share a little bit about what she thinks we can do, whether it's at the legislative level or just even at the community level to provide better protections. So welcome, Representative Pruso. Thank you for being here.
First, I wanted to thank you and the rest of HAPA and, in particular, Sani and Fern for digging into the data. And Fern has been working on this data analysis for so long that it's really remarkable. It demonstrates a lot of resilience because I know that it was really frustrating. And I think that what I find really hopeful about what's happening in the community now is that there are more conversations about pesticide use, and what used to be, a fairly divisive topic, at least in one part of my district, is becoming, it's less divisive when we can talk about the impacts on public health and when we can show data. And I just think that that is so important, especially when the data shows that we experience such a disproportionate impact in this district, in our communities, in Central Oahu and going out towards the North Shore, in Waialua, even close to Mokuleia. I would say that some of our, I would say that some of our folks who live out there, this has not been really part of their mental mapping of their daily lives, because the pesticide use is invisible to us, because most of it is happening on big agro-industrial parcels, and it's not perceptible, really. And it does become apparent, though, when we start to experience these health outcomes, and to make those correlations, right? And to be thinking about what do we need to put in place to protect our communities. And I think buffer zones legislation, it proceeded further than it has in the past this session. I think, I think we're very excited that it made it out of the Senate. And we still have some work to do, I think, in the House. And I would say the same is true with the reporting. I know less about the trajectory of that legislation because we didn't have much contact with it. But I think that what's happening now, raising community awareness, is exactly the foundation that change is built on. So my experience in the legislature is that, it's very easy to just reproduce the status quo. And we are under such time constraints. I mean, that is one reality of the work, that our time is so limited, and we have so many overwhelming problems to address. And we, in my view, are inadequate in our response, in part because there's a lot to work on. But my experience has been that when there's community pressure, when there's community voice at the Capitol, we are much more likely to be successful. And I really think that voice has to come from a place of information, because I think that when folks go to the Capitol, even in mass, in hundreds, if they don't understand the legislation that's being proposed, it's far less effective. It's not compelling for legislators, and legislators really want to know that not only is the community passionate about something, but they really understand what they're talking about. And so I think that these informational sessions, the working groups that you are doing, like the community forums, that's kind of going to be the foundation for any sustained change. And I think this is going to be a neighbor to neighbor kind of movement. People are going to have to talk to their neighbors. People are going to have to start looking at the foods that we're purchasing. I mean, I've been thinking a lot about boycotts, And, you know, I think that if we know that particular producers, I think that uh, Larry Jeffs it uses an extraordinary amount of pesticides, then I think that we're well within our rights to organize something approximating a boycott, right? We know what his tomatoes look like. We know what his watermelons look like. And I think there's been fair warning. And I think that those folks who are misusing and abusing and overusing these pesticides to the tune of hundreds of thousands of pounds of active ingredients, then they are making a choice. They also see this data, and if they are continuing these practices, then they are not holding themselves accountable for the impacts on the community. And so we need to figure out ways to hold them accountable. So I know that, you know, I was meant to talk about like legislative action, how to get involved in the legislature, but I think that a community action will kind of feed into that legislative action and make it stronger. And also make it more visible, right? I think that when people testify at the Capitol, it's easy for that to kind of be erased from community understanding. Like not everyone is paying attention to what happens at the Capitol. But if you start having conversations about this at the neighborhood board level, and we start having conversations about it at the checkout counter in the supermarket, then it's a community conversation. And you know, these producers, only half of the 10 are actually producing food for our communities. We need to figure out ways to hold them accountable. So I think that our community is super genius, and we can come up with those ways. So I'm eager for that kind of conversation.
Thank you so much, Amy. Yeah, and I think, you know, like just to that point that you mentioned about the community maybe not being aware, I think, you know, a lot of the early conversations when, you know, Fern mentioned Bill 2491 and some of the early activism, it was during days when, you know, especially agrochemical tenants were really right up against homes and schools. And so there were these acute exposure incidents, right, where people, you know, there was like, you know, went to the hospital, got sick, you know, there were these very noticeable symptoms. But what we don't often talk about enough at the, you know, it's not often part of the conversation at the legislature, but is the low level chronic exposure. And that's a situation where, you know, communities might not even know that they're being exposed. And it's just low level, it's kind of under the radar, but it's chronic, it's daily, you know, it's this regular application. And so that's kind of some of our concerns, especially around this fumigant, like just uncovering all this fumigant use, Rep. Prusso in your district. So I'm hoping that that conversation we can, you know, just be a source of like, you know, credible information on the usage and getting that out to communities and just supporting communities and how they want to engage moving forward. Because I really do think it, you know, we'll continue to like advocate for best, what we think is like, you know, best practices for public health. But I think really, yeah, like really would like to, you know, mostly support folks on the ground who are exposed and what they want to see for their communities. So I just wanted to say, you know, like before we open it up for Q&A, please, to the folks who are attending, especially residents of impacted communities, please always feel free to reach out to us to meet one-on-one. We're always, you know, happy to meet, whether it's Fern or ISIS. We can drop the email addresses in the chat for folks. And then if folks do want to get involved at the legislature, we do support these bills every year, and we do regular alerts. We have, you know, as Rep. Prusso mentioned, sadly, all the bills for this session are dead. Although, you know, buffer zones surprisingly made it through the Senate, and that hasn't happened since we passed Act 45 in 2018. So I just think, yeah, there'll need to be, you know, more engagement probably to get it moving in the House. So would really welcome, you know, any engagement from folks. And with that, I think we can open it up to Q&A if all of our speakers would like to. Oh, Amy, go ahead.
I just wanted to ask you to talk a little bit about, because we're talking about community action as is sometimes connected to legislative action, but can you talk a little bit about the work that HAPA did in our community at Lelehua High School when we really, I mean, this is my first year of service in 2019. But can you talk about the work that you did and the outcomes for that? While we may not see the same outcomes right now, I think that was a really important moment.
Yeah, thanks for flagging that. So, as Amy mentioned, we invited over the first groundskeeper who actually successfully sued Monsanto Bayer for their glyphosate exposure, which resulted in non-Hodgkin's lymphoma. And so, if you've been following any of the folks who are listening in, there's just tens of thousands, I believe, of lawsuits at this point for folks who have developed non-Hodgkin's lymphoma after using glyphosate. And we brought him over because he was a school groundskeeper, and he's just, his name's Lee Johnson, became a really passionate advocate for at least, helping to helping to encourage communities to transition away from that kind of usage, that kind of herbicide usage, glyphosate-based herbicides. And so we held a series of meetings actually across Hawaii with school groundskeepers, and one in particular at Lelehua, where the Board of Education came. And after hearing his story, issued a memo the next day, basically effectively banning glyphosate-based herbicide use on school campuses. The status of that ban is maybe a little questionable. I think we need to check in on it and just make sure that it's actually being enacted. But it's just showing that when you hear that, you bring those stories of impact to decision makers, it can actually have a tangible impact and make our communities safer. So yeah, thanks for flagging that. And with that, I think I'll go ahead and open it up to questions from attendees. Please feel free to drop any questions you have around, in the Q&A. So I see a question here from Clayton Kubo from Waimea asking Representative Pruso, when will the legislature put in place serious buffer zones around homes and roads?
When the legislature, the folks in decision-making positions feel pressured to do that. It won't be automatic, and it won't be as a result of just a couple people submitting testimony. There needs to be social movement. There needs to be like a groundswell of people who are making that demand. And that's something we can build. Like that's what organizing is about.
Thank you. The second question is also directed to Representative Pruso. Amy, can your community and other community get involved with the how can your community and other community get involved with the legislative process?
They can be like you, Clayton. So Clayton is very active at the legislature and is a great partner, and also in the sense that he's also holding me accountable all the time. But what you can do is you can create an account on the Capitol website. You can track legislation. HAPA does a really great job if you follow them on social media, on Facebook and on Instagram, but also other organizations like the Food Systems Networks. I'm trying to think of, like, there are a number of organizations that are tracking bills having to do with food systems, and a lot of them track the legislation around pesticides. So that's one way of getting information. But also, I think most importantly, creating your own account at the Capitol website and then setting it up so you can track anything related to pesticides, and then weighing in. That's the most important part, actually. Submitting written testimony, testifying via Zoom. Now that's available, so you don't necessarily have to fly over if you're a neighbor island person, or drive all the way to town. And you can still engage in that conversation and be available for questions. So when legislators have questions about how you as a community member are directed, they can ask you and they can have that conversation. So I think that is really important. I don't think the legislative process is everything. It's a necessary but not sufficient condition for change. So
Thanks, Amy. Yeah, and then there were a few questions about the recording, whether the recording will be made available. Yes, we are recording the discussion and we will have that up on HAPA's website. And then there's another question about what are the Department of Agriculture's arguments against reporting pesticide use data in a user-friendly format? That is a really good question, and that's something we've actually been able, I don't know, Fern, you've been able to really build a relationship with the pesticides branch at this point, and so I'm hoping that we can, it's early days in the reporting, 2019 was the first year. But we're hoping there might be ways to kind of streamline the work and avoid the redundancies between what the department is doing internally and the really heavy data cleaning lift that we've been doing. Fern, I don't know if you want to share anything else around that.
Yeah, I mean, I'll say that, over the last 10 plus years of trying to engage with the DOA and get action, largely that has been met with a stone wall. But in the last few years, they have been a lot more receptive. The former director of the DOA, Dexter Kishida, was really helpful in me being able to navigate some of those things and be able to ask questions. I'd say that some of the biggest arguments against reporting, at least the way it comes off, sounds like money and resources. So sounds like the cost and the lift that is to an already underfunded and overstretched agency. There's also serious concern about what the location looks like. And so the location without a specific location is very, very difficult for farmers to be able to report a location. And there's this argument that, oh, nobody has GPSs or some of them don't have smartphones. And one of the things that's been really hard with the data is that some of it's even handwritten. It's just a wide swath of data that you get in different forms and different measurements and all of these different things. And I think some of it is saying, oh, we don't want to make farming any harder than it is. I think it would be inaccurate to say that there's also some concern about this data being public, about things like boycotts, about things like holding accountable some of these really heavy users. So I think that could be part of it as well. Those are some of the arguments that I've heard so far.
Right. Yeah, and I think, there for a long time before the data was accessible, we often heard the argument that, having the kind of, policies in place like, California has, for example, they've had these policies for like this, as Sunny mentioned, the largest agricultural producing state. They've had reporting, they've had, quarter mile buffer zones around schools for quite a while now. And, agriculture hasn't collapsed. And so I think, what the data kind of revealed is like, there's really this like small handful of users who use a lot. And, yeah, actually the majority of like, I forget how many farms it is in Hawaii. It's like three, I don't know. Is it, anyhow, I don't want to say the wrong number, but it's thousands. But these like, five or so operators, conventional operators who are growing some kind of food that's very kind of, I mean, they may be larger producers, but in terms of the tapestry of producers across Hawaii, it's kind of a pretty small subset. And then that other piece being the agrochemical tenants that are testing experimental pesticides. Like, I just want to point also that we don't even have the data on like field trials anymore in Hawaii about experimental field trials, which we used to be able to have access to. So yeah, there's a lot, there's a lot more we could be doing, and I don't think it would have the, negative impacts on agriculture that sometimes get claimed. Let's see, there's one more question. Would the researchers like to name a few of the biggest offenders on the islands when it comes to these really heavy users?
After reviewing the data for the last few days in depth, it does look like a lot of those users are the same. It's really a handful of big plantation style. So We've got obviously Dole in Central Oahu. They're the ones using the 1,3-D. It doesn't look like anyone else is using it in Oahu at all. And then the other fumigant, metamsodium, was being heavily used by the adjacent farm, which is Sugarland Farms. Um, the big expected experimental corporations, the chemical corporations, Bayer, Monsanto, Syngenta, which is now Hartung, Pioneer, which also functions as Corteva. Those three also come up in a lot of this data. We're not totally sure what that looks like in the sense of their experimental research permits. There's some question as to whether they have to report the full swath of what they use because of some of these federal exemptions that may be present under the experimental research that they're doing. So the difference between Dole and Sugarland producing product that actually goes to agricultural market is that almost all of the products that are produced by the big chemical seed companies are really experimental research for different genetically engineered traits. And so you can see a lot heavier use and mixed use because they're trying to see what experiments they can conduct to either not kill or kill a plant or create some sort of pest resistance. So it's no surprise that they come up, but I think that there may be a bigger picture that's not being shared, and part of that goes back to the type of pesticides that we're talking about. We've been discussing, restricted use pesticides, which I explained at the beginning of my talk have kind of different parameters than general use, but California has 3 times as many as Hawaii does. And so it very well may be that some of those pesticides that they were having to report on have been pivoted to those that they don't have to report on because of our leniency with pesticides historically in Hawaii, leading us to have a lot less registered as restricted use. So it's hard to know the full extent of their use, but they definitely come up in those top few. I think off the top of my head, one of the only paraquat users outside of that was Turtle Bay, came up as some paraquat use. A significant chunk of that I can't recall off the top of my head if it was 2020 or 2021. So definitely we're seeing some stuff that's not just the traditional ag producers, but that would be Oahu. The other one is Loon Farms. So they would be the other actual food producer that's got a wide swath of RUP reporting coming in.
Yeah, and I just want to mention also, because we don't really touch on West Kauai in this reporting too much, but there is historically been, at least according to the 2019 data, the most frequent applications. So I think there's a lot of different lenses that we can look at the data through, which is concerning in of itself. A lot of the chemical companies are now, they've relocated from around Waimea town out to Mana on the ADC lands. There's a huge, almost 13,000 acre parcel out near like Polihale State Park. And there's, we looked at the 2019 data, there was the most frequent applications over there. So that's concerning in its own, and a ton of different types of RUPs as well. So our hope, over the next year is to have smaller community meetings and just to connect with folks in the communities where there is heavy use beyond Central Oahu as well. So please do feel free to reach out to us. However we can, just make this information accessible and transparent. Fern's going to be, in her new role as our pesticides and public health campaign director, really spending a lot of the next year trying to get that information more out into the community. So please feel free to reach out if we can even just meet up in a small house meeting or one-on-one. We're always happy to do that. And also I just like to encourage folks to also sign up for our mailing list because we do give regular updates. We'll drop that info in the chat and follow us on social media because we'll be sharing information out there as well. And I don't see any more questions in the chat, but are there any final thoughts from our panelists tonight before we wrap up?
I'd just like to thank you all for joining us today and for, being a part of this conversation. The focus groups were really so moving and so powerful, and I am proud to share those data with you.
Yeah, I mean, I echo the gratitude for everyone that took the time this evening to join, and for those that continue to engage. Clayton lives on my island with me over here on Kauai, and I'm super grateful that he's kept speaking up because a lot of people have either burnt out by this conversation, become frustrated with the lack of action, and walked away, and um it's super inspiring to have those few people that still call, that still care, that still want to be involved in that conversation, because we really need that engagement, to answer Clayton's question about when we're going to get change. And I think it's not going to be until we have those large groups of voices raising up and saying, no, this, like, we want these protections, we want this accountability. And it's hard for me, with my ecological background and my environmental science and chemistry background, and then 18 years of working on this issue and now all the data, to not see better response and action from decision makers and our government. It's really frustrating. We're dealing with the global collapse of our insects. We're dealing with really unhealthy societies and communities, exposed to so much. And it seems like the writing is on the wall with the exposure that we have to all these chemicals, just in everyday life, and particularly in these certain areas. And the fact that it's not common sense to protect communities against this stuff is hard. So I think, the more that everyone on this can stay engaged and talk about this with their community and get other people to say, yeah, like, I think my kid deserves that buffer zone. And, we need accountability. I think the more that we have that, the more that we're going to get closer to those things that we want to see. And I encourage people to be like Clayton and stay the course, because it is really difficult, to navigate that and still see your community. I mean, just recently he was sharing with me how he'd been driving down the road and got these wafts of spray happening, in West Kauai. Where you can taste it and you can feel it, and you just got sprayed, and that's a really direct contact. And it's totally unacceptable. And we need people to stay the course, and we need people to commit to this long term. I mean, sometimes social change takes decades of work and pressure. And so I just appreciate, everybody that did come on and care, and those that continue to have that conversation and help us build that momentum.
Yeah, I echo all of that. Thank you, for both your research, but also your willingness to engage with our community. It means a lot to me. And then also for community members who come out, like I see members of our neighborhood board, I see TJ, I see Yvonne, I see a lot of folks, and Kaulana Ing, a lot of folks from my community who really care about the community and want to take care of it. And I think that we can do this work. And I think that what we need is the knowledge, the information, and you're helping us with that. And that's everything. So now, armed with that kind of analysis and bringing community together to talk about it, we can start to develop strategies. And I don't think that we should be limiting ourselves to the legislature. I really do want to take it to the most egregious offenders and like lay it at their doorstep, you know. And I look forward to my community giving me feedback and ideas, and just inspiration to do that kind of engagement, because, and I trust in my community will, because that's our relationship. So I'm really grateful for you folks bringing all of this together and making this happen over the course of months and years. So thank you.
Thank you, Representative Pruso. I just noticed TJ, as you mentioned, has dropped some kind of questions and comments in the Q&A. And so, yeah, I mean, I will be honest, like when we saw these big food producers, some of the heaviest users, we wanted to be sensitive about that balance between, you know, what can be perceived as attacking agriculture, and also just the fact that like neither Fern or I live in your community, you know, so we didn't want to just parachute in and be like, you know, this is what, you know, telling the community what they should do, but we wanted to just provide the resources to help people to, you know, organize however they see fit. But that said, you know, we're willing to help, and we're willing to, if we're, you know, invited by community to engage in, you know, we'll support however we can. But I do feel like it's just, you know, an interesting, you know, we try to be sensitive about the fact that that's not the community that we live in too. And not wanting to, yeah, we want to take direction from the community rather than dictate what should be done. But, you know, TJ, just let us know. Um, and let's see, I think that's all the questions. So I think with that, we can wrap up a little bit early tonight if there's no more questions. And I just want to thank everybody for tuning in. We will drop our contact info in the chat once again, so folks can reach out. And yeah, let us know how we can be helpful. Okay, thanks everyone.
Good night.
Have a
Thank you.
good
Good night.
evening.
Aloha.
Ah.